If this is your first time watching, let me catch you up. 4 weeks ago, my Dachshund Foxy needed emergency surgery for grade 4 IVDD. A herniated disc compressed her spinal cord and left her paralyzed from the waist down. Each week, I've been documenting her rehabilitation journey. She's now walking again, which is why I feel comfortable sharing those videos. The surgery happened during the Christmas holidays, so I'm pleased to say she's walking again now. Throughout everything, Foxy's been a fighter, courageous and enthusiastic about her exercise routine. Let's look at week 4 of her recovery. I introduced ground poles to help encourage her lift her back legs higher. You can see she's able to move her back legs better now, 4 weeks post-surgery, but she doesn't have good control of where her paws are. She would just whack the poles and they'd move. This was the first time I tried using them. I would have been better to tape them down so she didn't move the poles. The space between the poles should be 1 stride, but I gave her more to make it easier. Now we're doing heel exercises where she's just walking alongside, practicing moving her legs left, right, left, right. Foxy likes to do things very fast, so it's important for her to do it slow and controlled. She finds heel work quite boring, but repetition is key. She loves food, so she's very motivated to follow along with the exercises. She also loves being the center of attention, so she was really keen on her exercises. Amy also loved joining in. She likes to walk too because she knows she'll get a treat. She did tend to try and be 1 step ahead though. We practiced this many times a day, just walking on carpet, which allowed Foxy to have much better grip compared to the hardwood floors. This was quite nice for them to do together, as we obviously couldn't go on big walks like Foxy was used to. It's important to keep her mind busy. As she gets tired, she would start bunny hopping, as you can see her doing now, and she would sometimes fall over. But most of the time she was able to hold her back end up. Once she got tired, I would use the sling. This just helped take some of the weight off her legs so she could concentrate more on the movement. You can see her tail going. She's really happy to do this. She's such a sweetheart. She just loves to please. She never complained once, even at the beginning stages where she was unable to walk, had pain and felt tired from the anesthesia. She was just such a good trooper from the beginning. She's such an inspiration. You can see she's got tired here. She's dragging her back legs now. That's usually the point where we have to stop, and then she gets her much-awaited treats. After a break, we tried the poles again. She's meant to lift her back legs over the poles. This is the next day, and she's a little bit better already. You can see she's understanding what we have to do, but she just wants to go way too fast. This time Amy decided to join in. I was trying to get Foxy to stay on the carpet, but sometimes Amy would push her off to the side. Amy's a little bit more lazy than Foxy, so she would often just walk along the edge to avoid the poles. I think Foxy knows that it's helping her, so that's why she would try to use the poles. I'm standing on the poles to try to stop them moving, but she's sometimes too fast for me as she just wants to skip ahead. I probably should have taped them down. Foxy does not like break time. She always wants to be on the go, so she's waiting for the command so she can get up. Now she's had a break and we're ready to go again. I'm stepping on the poles to stop them moving. She seems to really enjoy this. She does get distracted by sniffing a little bit, but she's generally quite keen. She has to do it quite slowly so she can really concentrate on her stride and lifting her legs over the poles. She does knock them, so it's important to correct the positioning in between runs. You can see both dogs are always keen to do the exercises. When I get the physio cushions out, they come by themselves. I don't have to call them. You can see Foxy shaking quite a lot. The balance cushion is a little bit tricky for her at the beginning. She has to really learn how to stand. This is great for strengthening her back muscles because you can see she has quite a curved arch. I'm trying to make her back more straight by pulling her back legs a little bit further back. She doesn't particularly like this, so I have to do it gradually. The balancing is also really good for her because she has to learn how to distribute her weight on the front and her back legs. Her right back leg is her weakest leg. You can see she tips over on the right side much more than the left. Amy always wants to be part of the exercises. She always comes to join in. Ideally, Foxy should have her head straight so her back is also straight. I'm shifting her weight from the front to her back legs. I'm holding her by the shoulders, trying to keep everything as straight as possible. Then I'm also doing left-right exercises. You want to do it controlled, relatively slowly, give her time to comprehend where her weight is. If you do it too fast, then she's not able to register the exercises properly. When she gets tired, she does tend to fold over. It's much harder for her to be supported at the shoulder area rather than the hips, so we're just practicing that. Now we're doing paw exercises, making her keep her weight on 3 legs. Foxy loves giving paw, so she gets a bit too excited. We're practicing giving the paw slowly, which is hard for her because she doesn't like doing things slowly. That was better, slow and controlled. You can see how quick she loses her balance as soon as one leg is lifted. It's much better to do it slowly and controlled. I'm also supporting her chest so she doesn't fall over. We don't want her to hurt herself. She's just way too rushed. I've got 2 balance cushions next to each other. She's shaking a little bit. If I hold the cushion for a few seconds, she finds her balance. Then I'm trying to correct her position so she's straight and her back is as straight as possible too. She does tend to pull her back legs inward to arch her back, and this is what we're working on. A lot of the time I'm getting her to stand straight and balanced. She gets a bit bored, so I'm trying to motivate her to keep her standing. Shifting her weight, you can see how she's shaking. I'm just gently correcting her. We make sure to do lots of breaks, give lots of rewards and lots of cuddles. When I feel she's getting tired, I put her on her side and then it's not too much effort on her part. I'm pinching her toes, stimulating her nerves to fire, giving her belly rubs, moving her back legs in a passive way, stretching, flexing her legs, rotating them in a bicycle motion both ways. The trick is to do small sessions many times a day. We would try and do 5 to 10 minute sessions 4 to 5 times a day. Obviously, she would always get a treat at the end, so she was always quite keen when I got the cushions out. This is just a yoga pillow with a 15 centimeter diameter, which is great for Dachshunds to put between their legs. It just supports her a little bit. I also put her front legs on the top of the pillow, which helps as wobble exercises as well. She has to really work on her balance. Sometimes when she's tired, she just wants to lie down on the pillow. You can see how she likes to curve her back. She's not stretching it out. I'm also using a harness on her hips. It's actually just her baby harness, which doesn't fit her on the chest anymore, but fits perfectly on her bum. You can attach a lead which helps protect my own back so I don't have to be leaning over her all the time. I'm checking her proprioception with the table test. The normal reflex would be for her as soon as the edge of the table touches her paws, that's when she would lift her legs up and then place them on the table. She's not able to do this yet. Now I'm comparing this test to my other dog. As soon as the edge of the table touches her legs, she lifts her legs up. I'm using the reflex hammer to check her reflexes. They were reduced initially. They're getting better, but they're not perfect. You can see the front leg reaction is more pronounced compared to the hind limb reflexes. It was January and we had quite a lot of snow, which Foxy is not the biggest fan of. But she was starting to show interest. She's sniffing around the garden, going to the toilet all by herself without a sling. Now she's also exploring the garden, not just going out, doing her business and coming back in. She's asking to go out as well. She's an absolute superstar. Because it was snowy, I had to try and keep her mind busy indoors because I couldn't really take her outside much. It's very slippery and I didn't want her to fall and hurt herself. Time for more wobble exercises. She's lifting her right leg. She should have all 4 legs straight, but her right back leg is the weakest one, so she likes to pull this up. I'm adjusting her position. Here I'm testing the paw placement reflex, where she should correct her leg position when knuckled over. She's not able to place her paw by herself yet normally. Sometimes she does correct it, but it just takes some time. Now I'm just holding her as she's standing, strengthening her back muscles. You can see how her paw placement is improving. Here's another session where we're just doing some balance exercises. A lot of the time I wasn't even moving her. I was just trying to focus on her standing just to keep her muscles activated and help prevent muscle wastage. It's so hard to build muscle up once you lose it, so it's important to maintain her muscles as much as possible. As a preventative for Amy, my other dog, who is absolutely fine, I would also do a few minutes with her every single session as well. First of all, she doesn't like to be left out, so she always wants to do everything Foxy does. And it's good for her too. She's doing her paw lifting here to balance on 3 legs. She's quite good at doing things by herself, so I don't have to lift her. You can see Foxy's waiting patiently for her turn. Now Foxy's waiting to lift her paws too. Foxy loves to give paws, so she's just trying to do it from where she is as well. Here are some weight shifting exercises with Amy. Front, back, left, right. And then we're lifting each leg. You can see how Foxy really wants to participate. She really wants to do paw as well. She wants to have a turn again. This made my job really easy because I didn't have to force anything. They both naturally wanted to do the exercises. This is really hard for her and she's doing a great job. I also used those lick mats which you can stick on glass or on the fridge. I used plain yogurt. I guess you can use peanut butter, but I don't want to give them too much sugar. I'm being careful about the diet, especially now that Foxy can't do too much exercise. You can see how curved Foxy's back is because I'm filming. I wasn't able to straighten her. Normally I would correct this by placing her back legs further back. This was the nighttime treat. Because she's so focused on the food, I can pretty much do anything while she's eating. When you look at Amy and Foxy in comparison, you can see Amy's back is much straighter than Foxy's. They absolutely love yogurt. It's one of their favorite treats ever. I was really lucky because Foxy is a really clean dog. It was the 3rd day post-surgery and she was already asking to go out to the toilet. Initially, I would support her with a sling and hold her up. But now, even in the snow, when it's slippery and a bit icy, she's able to go by herself. This is great because Foxy is a very independent dog. She doesn't really like to rely on me to do things. She was absolutely devastated that she urinated inside the first few days because she lost control of her bladder and bowels. This obviously wasn't her fault and she was really upset about it. So I'm really pleased for her that she managed to gain control of her bowels very early on in the recovery journey. She doesn't like the cold, so she's happy to go back in. Week 4 has shown incredible progress. She was able to go to the toilet by herself in the snow, learnt some new pole exercises, and she was shaking way less on the wobble cushions and improved her balance immensely. Foxy's determination and enthusiasm made all the difference. Doing small, consistent sessions multiple times a day kept her muscles strong and her mind engaged. Thank you so much for watching and following Foxy's rehabilitation journey. We'll see you in the next video.